If you're over 50 and waking up multiple times a night to pee, you probably think it's just aging. It's not. One prostate problem gets dramatically more common after 50, and it can quietly wreck far more than your sleep. You roll over and check the clock, 3:12 in the morning, and sigh. Another trip to the bathroom. Maybe you tell yourself it is no big deal, just part of getting older, right? Maybe you even joke about it with your buddies or brush it off when your partner asks if you are okay. A lot of men shrug it off, thinking I can handle it, or it's not worth making a fuss. But let's be honest, when you're waking up 2, 3, even 4 times a night, it is not just a minor annoyance. Broken sleep catches up with you. You feel it the next morning in the heavy eyes, the short temper, the lost focus. Still, most guys keep quiet. They chalk it up to age, pour another cup of coffee, and push through the day. It is easy to ignore these changes, to pretend they are just a normal part of the ride. But sometimes what feels like just aging is actually your body waving a red flag. And the truth is, you are not the only one making those late-night trips. This is a story almost every man over 50 knows, even if nobody is talking about it. It is called benign prostatic hyperplasia. Most men call it an enlarged prostate, or BPH for short. Here is what is really going on. Right below your bladder sits a small gland, the prostate. It wraps around the urethra, the thin tube that carries urine out. As men get older, this gland tends to grow. It is not cancer, it is not dangerous in itself, but it can crowd that tube and make bathroom trips a lot more complicated. How common is this? By age 60, about half of men could have some degree of BPH. By age 70, that number climbs even higher, to 70 or 80%. This is not a rare thing or a weird fluke. It is practically a common experience for men over 50. So if you have noticed things changing down there, you are in good company. BPH is one of the most common issues men face as they age. But just because it is common does not mean you have to put up with it or ignore what your body is telling you. Standing at a urinal, waiting for a stream that barely starts, then stops and starts again. This is how benign prostatic hyperplasia, or BPH, shows up. The sense of never quite finishing, the constant urge, the need to plan every outing around bathroom stops. For some men, it means waking up at night, sometimes twice or more. In fact, about 70% of men with benign prostatic hyperplasia get up at least 2 times a night to pee. That broken sleep leaves mornings heavy, minds foggy, tempers short. The symptoms pile up: weak flow, dribbling, urgency, hesitancy, incomplete emptying, frequent trips, and nocturia. Each one chips away at daily life. Social plans get skipped, long drives become stressful, even a movie feels risky. One traveler summed it up: long drives used to mean freedom. Now I map out every rest stop before I even leave the driveway. Confidence fades, energy drains, and the effects ripple through work, relationships, and mood. Here's the truth most guys miss. Ignoring these symptoms doesn't make you tough. It just makes life harder. 2 big mistakes keep men stuck. First, thinking it's just age and there's nothing you can do. Second, worrying that any change down there must mean cancer. Both are wrong, and both keep men quiet when they should be taking action. Here is a wake-up call. Every week, emergency rooms see men who waited too long. The story's almost always the same: a man who brushed off the warning signs then suddenly can't urinate at all, or develops pain and fever that won't quit. One urologist said most of these emergencies could have been avoided if men had spoken up sooner. Benign prostatic hyperplasia, also called BPH, is not a sign of weakness. It is a common part of aging, and there are good treatments. Most prostate problems are not cancer. Letting symptoms drag on without a plan is not just aging, it is risking bigger problems. There is no medal for suffering in silence. If your body's sending signals, it's time to listen before a quiet problem turns into a crisis. Some symptoms are just annoying. Others are your body's way of saying, "Get checked now." Here's what shouldn't be ignored. If you suddenly can't pee at all, that's an emergency. Blood in your urine, especially if it is enough to form clots, needs a doctor's attention. Fever or chills along with urinary trouble could mean an infection that is getting serious. Sharp pain in your lower back or sides might signal your kidneys are under pressure. And if urination becomes so painful you can barely stand it, don't tough it out. These red flags are not just part of aging. They could point to urgent problems that need fast action. If you spot any of these, don't wait. Get checked right away. Here is a practical fixer mindset. Start by tracking your symptoms. Keep a simple diary, noting when you go, how often, and what feels off. That can reveal patterns you might miss. If nighttime trips are driving you nuts, try cutting back on fluids a few hours before bed. Caffeine and alcohol can make things worse for some men, so pay attention to what sets you off. If symptoms stick around or interfere with your routine, it is time for a checkup. Doctors may do a quick exam or run a prostate-specific antigen blood test. For many men, medications like alpha blockers or 5-alpha reductase inhibitors can help. And if those do not cut it, there are procedures that can open things up. Bottom line, you have options. There is no need to tough it out in silence. You are not alone. Benign prostatic hyperplasia, or BPH, affects most men over 50. Ignoring symptoms will not fix them, but taking action can. Your comfort and confidence matter now more than ever. Do not just tough it out.